Today I'm going to talk about severe malnutrition. Now there is a small topic which I'm sure you can do on your own, and if I have enough time I can revise that later on. That is danger signs in the newborn. I have shortly described that already, but there is one additional class for that. Okay, we can handle that later, or you can practice that on your own. So don't worry about that. Now let's focus on very important class, that is severe malnutrition. So please mute yourself, all of you. Now in the beginning, let's start like that. All of you please focus on the screen here. What can you see on this slide? These are the baby who are severely malnourished. Now, have a look here. The first one, it is a cachectic baby. Okay, there is only skin and bone visible there. Only skin and bone. I can count the ribs from outside. Okay, there is no subcutaneous fat at all. The baby looks quite older than its age. This is called marasmus. Marasmus. Now, whereas look at the second baby now. The tummy is swollen. Okay, it looks like a little bit edematous. The lower limbs are edematous, and the overall face looks puffy. This baby is kwashiorkor. Kwashiorkor. This baby is also severely malnourished. Though the baby looks a bit of plump, and many of the parents, they are confused. Oh, my baby is fine because he still looks relatively fat. But actually, this is because of collection of the fluid. There is no subcutaneous fat, and most of the muscles are atrophied. So this is kwashiorkor. This is called marasmic kwashiorkor. Marasmic kwashiorkor. Look at the ribs here. Okay, and at the same time a bit of swelling can be seen. So marasmic kwashiorkor, this is looks like kwashiorkor to me, and this also looks like kwashiorkor. Okay, so these are the pictures of severely malnourished babies. Let's move on. Now let's introduce the topic. Severe malnutrition is both a medical and a social disorder. Now, medical disorder we all know because it can give rise to so many medical problems. So many. We are going to talk about this. Social disorder, because of the decreased socio-economic status, because of the poverty, severe malnutrition is very common in most of the country all over the world. That's why it is listed as a social disorder. Please mute yourself. Nearly 12 million children are under the age of 5. They die annually, and malnutrition is a culprit in 55% of this death. So this shows the importance of the topic. Malnutrition is a killer problem in case of baby who are less than 5 years of age. Now, okay, so let's talk about one very important slide. All of you, please focus on this slide. Okay, I'll give you a bit of time here, and then few of the questions would be asked. Okay, so please focus here. Now, I'm sure, okay, most of the students have already seen it. So look at this and tell me, what are the 3 most common causes of death in case of babies who are under 5 years of age? Yes, what's the answer?
Prenatal death, malnutrition,
Prenatal death, diarrhea death, and acute respiratory.
Exactly. Okay, all of the students can answer that very correctly. Now see there, perinatal death, almost 37% of the cases, perinatal death. After that, If I go here, acute respiratory infection 19% of the time. This is pneumonia or low respiratory tract infection, and around 17% of the time it is diarrhea. So perinatal death, pneumonia and diarrhea, they are the most common cause of death under the age of 5. Now you may be wondering why I am not taking the malnutrition here. This malnutrition is contributing in all of these. See there, it is right at the center, and this malnutrition is contributing the death under 5 years of age in all of these situations. This is discussed in a little bit different way. If a child is malnourished, the child has high chance of getting pneumonia and die from that. Malnourished child often develops diarrhea. Malnourished child, because of the lack of immunity, they often get other type of infection as well. Okay, so this is how we explain. So if anybody asks you this question, just be confident and answer. Perinatal death, perinatal period, everyone know it starts from 22 weeks of gestation or 20 weeks of gestation till 7 days after birth. In some of the textbook, they also mention till 28 days after birth. It's okay. This is perinatal death. So it comprises baby who are dead before delivery, okay, at the time of delivery and after the delivery, perinatal death. Pneumonia and diarrhea, these are the three most common ones, followed by some others like malaria, measles, HIV and AIDS, and so many other diseases. Okay, and malnutrition is contributing the death in most of the situation. With this, let's move on. Now, what is the definition of protein energy malnutrition or malnutrition per se? World Health Organization (WHO) defines malnutrition as the cellular imbalance between the supply of nutrients and energy and the body's demand for them to ensure growth, maintenance, and specific function. So this is a clear-cut imbalance between supply and demand. Okay, there is a good demand because these babies are growing very rapidly, but at the same time, if the supply is not proper, if supply is far less than the demand, okay, it results in malnutrition. And nutrition is very much essential for growth, okay, maintenance, and specific functions of different organ system of our body. Now, the term PEM or protein energy malnutrition, very commonly used term, applies to a group of related disorder which range from mild undernutrition to severe form that include marasmus, kwashiorkor, and intermediate state of marasmus kwashiorkor or marasmic kwashiorkor, you can say. So these are the severe form, marasmus kwashiorkor and marasmic kwashiorkor. Sometimes the baby may be undernutrition, okay, a little bit less severe form. So these all are different spectrum of protein energy malnutrition, which we are going to talk in this class. Now, the term marasmus is derived from the Greek word marasmos, which means wasting. So let me go slowly, okay, with the proper description here. Wasting, see this. So it is derived from the Greek word marasmos, which means wasting. Wasting means there is no subcutaneous fat and there are no muscles. Muscles are there, okay, they are not disappearing, I'm not saying that, but these muscles are atrophied, okay, they become very, very atrophied. So from outside, I cannot see any muscle mass there, and there is no subcutaneous fat. So if subcutaneous fat is not there, the skin, okay, develops some folds on the body, the skin wrinkles on the body, okay, and the face looks like old man face. So this is a very, very important point. This is called wasting or marasmus. Marasmus involves inadequate intake of calorie and is characterized by emaciation. So see there, inadequate intake of calorie. This is the main cause of marasmus, and it is characterized by emaciation. Means severe weight loss is emaciation, severe type of wasting. The term kwashiorkor, on the other hand, means the sickness of the weaning. Now let me ask this question again. What is weaning? Yes, what is weaning?
First,
Weakness.
food give.
Yes, yes. Another student? Okay, so let me explain this now. Weaning means the first food which we introduce to the baby after exclusive breastfeeding, that is called weaning. The first type of food, okay, it may be solid food, it may be liquid food, whatever, usually it is solid. The first food which we introduce after the exclusive breastfeeding is over is called weaning. So kwashiorkor is also known as the sickness of the weaning, and Williams was the first person who used the term in 1933, and it refers to an inadequate protein intake. See this, inadequate protein intake with reasonable caloric intake. But overall calorie intake may be enough, but protein intake is less in kwashiorkor. As a result of that, there will be decreased oncotic pressure. That decreased oncotic pressure is leading edema. This is the physiology. So edema is a characteristic feature of kwashiorkor, but is absent in marasmus. Never forget this, okay? Whenever you see a kwashiorkor baby, the baby looks like a swollen baby because of the edematous fluid collection, but a marasmic baby is emaciated or wasted. And combination of both is called marasmic kwashiorkor. Both type of features are same. Let's move further. Okay. Now look at here. Let's talk about marasmus in a bit of detail. The child which is shown in the picture, this child was a low birth weight baby. Now what is the definition of low birth weight? Yes, anybody?
Less than
Less than 3.
2 kg or 5.
Now, okay, this point was not taught to you, that's why a little bit wrong answers are coming. Low birth weight baby means at the time of birth, if the baby's weight is less than 2.5 kg, okay, less than 2.5 kg, let me write it here. Less than 2.5 kg at the time of birth, irrespective of period of gestation, is called low birth weight. We don't care whether that baby is preterm baby, term baby, or post-term baby. Okay, that is not considered. If the weight is less than 2.5 kilo, it is low birth weight baby. So usually these babies are born low birth weight and remains chronically malnourished. Here, remains chronically malnourished as a result of fat and muscle tissues. They are depleted and the skin hangs in loose fold with the bone clearly visible beneath. This is a hallmark of marasmus. Muscles are atrophied. There is no subcutaneous fat anywhere in the body, so skin will develop loose fold, and sometimes they hang also, and that is very commonly seen in buttock area. Okay, if we remove the cloth of the child and look at the buttock area, the skin will be hanging like a loose fold from there, and most of the bones are visible clearly from outside. This is marasmic baby. One very important point is this baby is hyper alert and ravenously hungry. This baby wants food all the time. The appetite is maintained. So when we give food, the baby will finish that food in no time. Whereas in kwashiorkor, there is loss of appetite. Okay, So even if we offer the food, remember the baby is severely malnourished, but still the baby doesn't like to eat. Very, very important point. I'm talking about marasmus now. Let's focus it here. So the baby is hyper alert and ravenously hungry, means very hungry. This child's severe wasting makes him look like a wrinkled old man long before his time. So the baby looks like an old man. Okay, the face looks like an old man's face, much older than the real age of the child. This is marasmus. Sometimes some of the textbook even mention the baby's face looks like a monkey face. That is not a good term to use. Okay, we should not use this type of term in front of the parents. But the meaning here is, what I am explaining is, the face, okay, looks older than the actual age. This is marasmus. Let's move on. What about kwashiorkor? See here. Kwashiorkor, on the other hand, usually develops because of sudden food deprivation due to natural or man-made emergency. This is sudden food deprivation because of natural or man-made emergency, like a flooding, severe type of flooding in some of the areas, okay, which leads to, severe lack of food. So those type of situation I'm talking here, and it produces a condition known as kwashiorkor, where the baby is apathetic. Apathy means no interest in the surrounding, whereas the baby who is marasmic is alert. That is one of the difference. This baby is swollen because of collection of edematous fluid, especially of the extremities. The baby is also having edematous fluid in torso and the face. Torso means body, the main body part, okay, trunk we also call it, and face. The swollen face, which is called puffy face. The skin will be cracked and peeling, very important point, and it becomes prone to the infection. Cracked, peeling, and infection prone skin, which is not seen in marasmus. And the hair, okay, the hair become very sparse, means the hairs are fallen quite early, and only some amount of hair is left, and they become gray. They become gray or they become white quite early, means they will lose their natural shiny color. That typical healthy looking color of the hair is no more there. This is called unnaturally blonde hair, or sometimes they become gray as well. These all are very important features of kwashiorkor. Now let me give you important differences between kwashiorkor and marasmus before I move further. Marasmus is mainly developed because of severe caloric restriction, and kwashiorkor mainly develops because of protein restriction. First point. Second, marasmic baby is deprived of food for a long duration. It's a chronic sort of problem. But kwashiorkor baby is deprived of protein and relatively calorie for a shorter duration. For example, if the baby becomes acutely ill, okay, then also the features of kwashiorkor may be developed. Third point, marasmic babies are emaciated. They are emaciated. They are wasted. Only skin and bone they have. All of the muscles are atrophied and there is no subcutaneous fat. As a result of this, the skin develops loose fold. They may be hanging from the respective area, and the face looks like an old man's face. Whereas in kwashiorkor, the body is swollen because of edematous fluid. And because of this simple point, many of the parents, they confuse whether their child is ill or is still okay. So timely, admission to the hospital will be delayed in case of kwashiorkor. Another important point is skin. In marasmic baby's skin, there won't be this type of finding which we see in kwashiorkor, like cracked, peeling, infection-prone skin, highly common in kwashiorkor. In kwashiorkor baby's head, okay, the hairs are unnaturally blonde, and there is a high chance of hair falling with sparse hair. This is not commonly seen in marasmic baby. One more point which is not mentioned here, in kwashiorkor there is hepatomegaly. So let me write that point here. Hepatomegaly is common in kwashiorkor. Now what is hepatomegaly? Yes?
Enlargement of liver.
Exactly. Enlargement of the liver is hepatomegaly. Very good. So the liver may be palpable. So this is the point which is seen very commonly in kwashiorkor. In marasmus it is not seen. So these are important point. Okay, don't forget. Let's move on. Now we are entering to a very important part, okay, of this class, that is how to assess severe protein energy malnutrition. How to assess it. This is what you need to learn from this class. So please mute yourself. The first of them is a clinical assessment. Second is a nutritional assessment, and third is lab investigation. So let's go and talk one after other. So this is called clinical assessment. It is done by history taking and physical examination. That is clinical assessment. So we should take some good history, like what was the usual diet the child was taking before illness? Isn't it? This is a case of malnutrition. So this question is very, very important. If the child was taking good diet before illness, there is very decreased chance of development of malnutrition. Breastfeeding history, absolutely important in children. You should ask how long the child was breastfed. Was it exclusively breastfed for 6 months or not? If not, which food was introduced? Okay, all those questions are important. Recent intake of fluid and food. During this illness, what type of food the parents were giving? Was the child drinking enough fluid or not? Because there is high chance of dehydration in case of malnutrition as well. Recent sinking of the eye. Now this is the feature of dehydration. Recent sinking of the eye. This is called sunken eye, one of the feature of moderate and severe dehydration. Duration and frequency of vomiting or diarrhea, appearance of vomitus or diarrheal stool. I already told you acute gastroenteritis or diarrhea is very common in malnutrition. So we should ask this question, how many times the baby has vomited? How many times there was diarrheal stool? What was the color or appearance of each of the vomitus or diarrhea? Was there any blood in it or not? These questions are very important. When the baby passed urine last time, this is also a feature of dehydration. If the baby has not passed urine for whole 24 hours, this is a very critical case now. This is severe dehydration feature. But if the mother say, no problem with the urination, my baby is passing urine almost 4 to 6 times a day, no problem. Probably the baby was not dehydrated. Another question, was there any contact with people with measles or tuberculosis? Now, measles is a contagious disease which is caused by measles virus, and tuberculosis, every student know, is caused by Mycobacterium tuberculosis. It's a type of bacteria. Both are highly contagious illness. It can be transmitted from one person to the other, and both of these can lead to malnutrition. So we need to ask this question all the time. Let's move on. Any death, okay, in the family or in the siblings. Now the family maybe poor family, the socio-economic condition of the family is really low. As a result of this, multiple family members are suffering from malnutrition. Who knows? So we need to ask that question. What was the birth weight of the baby? Just now I discussed, usually in marasmus, the baby was born low birth weight. So it is an important type of question. Milestones reached. This is called development. If growth falls behind, then development will also be affected. Now remember one very important sentence I mentioned in the previous classes. The brain growth of a baby, okay, mostly occur before 2 years of age. Before 2 years of age. So if brain growth doesn't occur properly, then development will also be delayed. So see there, so malnutrition is affecting the development as well. Ask about the immunization. Now, one simple question we ask, for example, this baby is, okay, 1 year old. Okay, let's take an example. We ask one question to the mother. Your baby is 1 year of age. So did you give all the vaccines to your baby which is given till this age? And if she is quite confident, yes, doctor, I took my baby in time to the healthcare center for the vaccination, no problem. Can you show me that record? We can ask like that. If she is carrying that record, we can quickly see. So immunization history is also important. So these all are important medical history. Let's move on. Now, what about the physical examination? See here, weight and length or height. We always take this. This is a standard part of pediatric exam, and this is a case of malnutrition. So it is even more important here. What is the weight of the baby? Okay, if the baby is less than 2 years of age, we take the length. But if the age is more than 2 years, we take the height and record it. Okay, and then plot it in a chart and compare it with the normal standard. We'll talk about that. Examine for edema. Now, once again, the same question I like to ask you, edema is common in kwashiorkor or marasmus?
Kwashiorkor.
Exactly. Okay, it is seen in kwashiorkor. Very good. Kwashiorkor, or you can also say it is seen in marasmic kwashiorkor, because this is a combination of the thing. Kwashiorkor, excellent answer. Also can be said marasmic kwashiorkor. Enlargement or tenderness of the liver. Now let me highlight a little bit here. Now, see this, enlargement or tenderness of the liver. The enlargement of the liver is very common in kwashiorkor, but if that liver is tender also, this shows this baby may be having congestive cardiac failure or congestive heart failure, CHF. Now, what is the relation here? The malnourished baby has a high chance of development of heart failure. Now, what is the relation? Just like any other organ, the heart is also relatively atrophied in case of marasmic baby. If we give too much fluid from outside, thinking that this baby is dehydrated, that overloading of the fluid can lead to heart failure. And one of the very important feature of heart failure in children is congestion of the liver. Congestion of the liver. Now, when liver is congested, it will become bigger and it will be tender as well. So this is how you can explain. Okay, you see there. Another one is abdominal distension or presence of bowel sound. We need to examine for this. Now, there are different causes of abdominal distension. See here, so let me explain. The causes of abdominal distension in a malnourished child is hypokalemia. Now, what is hypokalemia? Yes? What is hypokalemia?
Low level of potassium.
Low level of potassium.
Excellent. Low level of potassium in the blood. Very good. Now, potassium, if it is low, okay, the muscles become floppy and the intestine, okay, inside our abdominal cavity will develop paralytic ileus. Okay, so let me write that term again for you. Paralytic ileus. Means there will be no peristaltic movement of the intestine. As a result of this, they become dilated or distended, and that can cause abdominal distension. Never forget this. This is quite common in both marasmic as well as kwashiorkor. Another point also I can highlight here, that is sometimes ascitic fluid is also there, but the ascitic fluid collection is not very common even in kwashiorkor baby. Severe pallor, very important feature in case of severe malnutrition. Anemia is quite common. If the baby is not taking enough nutrition or food, he is also not taking iron, okay, and iron deficiency anemia is very common in severe malnutrition. So we should always examine for a pallor, always. Now let's move on. Another one is signs of circulatory collapse. So what does that mean? This is shock, okay. Signs of circulatory collapse means features of shock. Now there are two important types of shock which can happen in malnourished child. One is hypovolemic shock as a result of severe diarrhea and vomiting, which is very common in malnutrition. Another is a septic shock because of lack of immunity, okay. There is septicemia or infection with high chance, any type of infection that can easily spread in the body, resulting in septicemia and septic shock. So we should examine for those signs. Temperature is always measured, is one of the vital sign, definitely, especially in this type of baby, we should measure it. Now, temperature can be high or temperature can be low. High temperature is called hyperthermia or fever. Low temperature is known as hypothermia. Now, let me tell a little bit about this. Low temperature is even more lethal than the high temperature. Low temperature or hypothermia can kill that baby without the knowledge of the doctor, nurses, and even the parents. Please mute yourself. So this is about temperature. Okay, wait. Now what I'm talking is the importance of temperature in this malnourished baby. Usually they develop hypothermia, and that hypothermia may kill them, and sometimes they can also develop fever. So very important part of the examination. Thirst, okay, thirst is important one. Now if the baby is thirsty, what does that mean? Anyone? If the baby is thirsty, what does that mean? It is a sign of what? Sign of dehydration.
Dehydration.
Yes.
Dehydration.
Sign of dehydration. Very good. Sign of dehydration. So, okay, we should offer a drink to the baby, probably a glass of water. Then how quickly the baby grabs that water and drinks, it shows the baby is thirsty. Examine the eyes. For the corneal lesion, which is indicative of vitamin A deficiency. Now, you must have studied this before. Vitamin A deficiency can result in xerophthalmia in case of babies. Xerophthalmia, okay. The literal meaning is dry eye, but that is a very broad term. There are a lot of findings in the eye. It starts from conjunctival dryness, then bitot spot, then corneal lesion, and ultimately, okay, ultimately the person develop blindness. So there are different things. We'll talk in some of the respective classes. Examine ear, mouth, and throat. Okay, examine ears, mouth, and throat. This is the evidence. Okay, EO is a evidence of infection. Who knows, there may be different infection there, so we should not miss them if they are present. Examine the skin for evidence of infection or purpura, especially more important in kwashiorkor baby. Examine the respiratory rate and the type of respiration suggestive of pneumonia or heart failure. Both are very common in severely malnourished child. So respiratory rate is high in both these conditions. Now in the last class, if you remember, I clearly told you there are three important respiratory rate which you should never forget. From birth to 2 months of age, the upper limit of respiratory rate is 60. If it is more than 60, it is abnormal. From 2 months till 12 months or 1 year, The upper limit is 50, and after that till 5 years it is 40. Never forget this. So simply counting the respiratory rate can give you the diagnosis. Another is appearance of the feces or fecal matter or stool. Now this is another important physical examination. We should ask the parents to collect that diarrheal stool if the baby is passing, or if the baby is in the hospital, nurses would do that. And when you are taking round, quickly have a look at what type of stool is that. Is there any blood in it or not? Is there any mucus or not? Now let me ask you a simple question. If there is mucus and blood in the stool, okay, what we call that?
Melina.
Okay, now that may be a little bit difficult questions for you, so let me write it here. So appearance of the feces, if there is mucus and blood in the stool, that means it is a type of dysentery. Okay, it's a type of dysentery. And sometimes even diarrhea can have that. This is called bloody diarrhea. Usually Campylobacter jejuni, okay, Shigella dysentery, these are the bacteria which can cause this. If there is watery type of stool, okay, another one, there is a watery stool, no mucus, no blood, most of these are caused by viruses like rotavirus, Norwalk virus, or probably caused by E. coli as well. Remember, there are different strains of the E. coli. Okay, some of the E. coli simply causes watery type of diarrhea. So appearance of the fecal matter is also very, very important during physical examination. What do you mean by nutritional status assessment of the malnutrition? Now, these are done by anthropometric measurements. Anthropometric measurements means you take weight, height, or mid-arm circumference of the child which has come to the hospital. After that, you compare, okay, you compare the anthropometric measurements with the standard one. Now you may be wondering from where I get the standard one. That is, okay, obtained from NCHS or CDC chart. NCHS or CDC chart. Now let me write you the full form of this, okay, because students want to know about this. So see here, NCHS is National Center for Health Statistic, okay, and CDC is Center for Disease Control. Both of these organizations belongs to United States, and they are the organization which have uh, formulated, I should say, different percentile chart. And what we do, if a child comes to us and if we suspect the child is a malnourished one, we take the height, weight and everything and then compare where does that fall in that percentile chart. So accordingly we take the percentage and classify the nutritional status. Now let's move on. Now, so how we do the classification now? For the purpose of classification, the term expected means the median or 50th percentile value of the reference standard. And these reference standard are NCHS or CDC chart. Now, let me clarify once again. When we look at those different chart, there are many lines there. These are called percentile line. You may be wondering what is the meaning of this percentile line, okay? So focus here. This is an important concept. If I want to know what is the average weight or average height of the children of that particular area. What I do, I will call all of them, okay, take the weight and height one after other and take the average one. This is the one. Now all of them do not have the same weight or height. It differs according to the children. All of them are not normal, or all of them are not abnormal also. That's why there is always a range, and this range is provided by this percentile chart. So if you see any percentile chart, of NCHS or CDC, there are different lines like 5th percentile, 10th percentile, 25th percentile, 50th percentile, 75 percentile, or 95th percentile, like that. So we always should plot it and then see where it falls. Now let me quickly show you that chart, okay, and I'll move further. Wait. Now see there, okay, see this. So this is the chart which I already showed in the last class also, if you remember. Now see here. So what I'm talking here is, this is the weight. This y-axis is for the weight, and this x-axis is for the age. And this is the a percentile chart, okay, which is developed by CDC. See here, CDC, and this is from the birth to 36 months of the age, and it is for the boys. Boys and girls have different chart. Now let's see, our child is 2 years of age, okay, 24 months is 2 years. Now see here, what is the 50th percentile that is considered the standard or the expected one for 2-year-old child. So this is the 50th percentile line, you can clearly see. 50th percentile line is this one, okay. Now this is the age of the child. So we trace it like this, and the point where it crosses the 50th percentile is the point we consider. Now what is the age here? Okay, what is the age? Just have a look at the age of this child. Sorry, weight of the child, I should say. Sorry, age is already 2 years. What is the weight? Where this point, okay, belong to? Which weight? Now I should come like this here and look at the weight. Almost 13 kg. Almost 13. So this is the way we find the expected one. Now another important job for you. If the current weight of this 2-year-old child, which you took in front of you in your clinic or hospital, is just 8 kg, but his expected weight is 13 kg. Now we should take a percentage out of it. 8 divided by 13 multiplied by 100. Now whatever percentage comes, according to that I will classify the grades of malnutrition in that child. This is how we do the nutritional status classification. Okay, now let's move on. Okay, I should go back now. See this. So this is the classification according to the nutritional status. Now see that according to that percentage which I just told you, the different classification systems come into the picture now. One is called IAP classification, Indian Academy of Pediatrics classification. This is, so let me write it here, Indian Academy of Pediatrics classification, IAP. Okay, now according to this is the classification system. More than 80% of the expected for age is normal. Grade 1 malnutrition is 71 to 80%. Grade 2 malnutrition 61 to 70%. Grade 3 malnutrition 51 to 60%, and grade 4 malnutrition less than 50%. Now to make you understand in a very easy way, I want to take again, okay, that example which we just gave. Now the current weight of 2-year-old child who came to you for the examination You found it only 8 kg, only 8 kg. Okay. Now, what is the expected weight we just see of that child? What is the expected weight? Expected weight of 2-year-old. How much you got just now from the chart?
13.
Okay, let's say almost 13 kg. Okay, it's easier for us. Let's say it's 12 kg. Okay, yes, it was almost near to 13, but for the easiness of calculation, I'm making it 12. Okay, because it is easy for us to calculate. Now, what are you going to do? Now, see here, I will put 8 at the top, divide by 12 because this is the expected one, and then I multiply it by 100. Now, can any one of you quickly calculate what is the percentage it comes here? Yes, guys? What's the percentage here? 8 divided by 12 multiplied by 100.
That's 66.6. That's 66.6.
66.6, sir.
Very good, excellent. 66.66. Okay, this is the percentage which you got. Very good. Now, let's use this percentage according to this classification where it falls. Which grade of malnutrition does this child falls into? See there? Now you can easily answer.
Grade 2.
Okay, which one? This is grade 2. Grade 2 because it is 66.66%. So 61 to 70% is grade 2 malnutrition. This is the way you calculate it. Okay, never forget it. This is the excellent way. Let's move on now. Another type of classification is even important than IAP classification. This is welcome trust classification. Okay, and this is a very good classification and most commonly asked in the exam as well. It is based on deficit in body weight for age and presence or absence of edema. Now see this, deficit in body weight for age and presence or absence of edema. Now similarly, just like what I taught you, just now, you calculate what is the weight for age. For example, that's a 2-year-old child. So the child was 8 kg, and according to the percentile chart, the standard weight for that age is almost 13 kg. So I will take the percentage, okay, just like what we did now. And I'll also examine whether there is presence or absence of edema or not. Accordingly, okay, we are going to classify it now. Here, presence or absence of edema, and then deficit in body weight for age. Now, if the weight falls between 60 to 80% of the expected with edema, this is called kwashiorkor. This is the definition of kwashiorkor. If weight for age falls between 60 to 80% of the expected with edema, this is kwashiorkor. Now, without edema, if weight falls between 60 to 80% of the expected, this is undernutrition. Undernutrition. If weight falls below 60% of the expected without edema, this is marasmus. See this? Less than 60% means severely wasted child. Without edema is marasmus. And weight below 60% of expected with edema is marasmic kwashiorkor. Okay, marasmic kwashiorkor. So kwashiorkor 60 to 80% of the weight for age with edema. Without edema, if it falls between 60 to 80% undernutrition. Below 60% of expected without edema, marasmus, and less than 60% with edema, marasmic kwashiorkor. Please revise this until and unless you are quite sure about it. Okay, let's move on now. Now, the third one, or third type of classification, or another classification I can say, is current nomenclature. This is given by WHO, and these are the very important terms which we use these days. See here, These are important to distinguish undernutrition from wasting. Now, wasting means deficit in weight for height, and stunting, that is deficit in height for age. Now, many students are confused right here. I'm sure about it. What is the meaning of weight for height? So let me explain this for you. Weight for height. Let's take one example. I am taking different children who are of same age, that is 10 years old. Okay, 10 years old child I'm collecting from a group of child. I am taking the height of all of them, but those height may not be the same. The heights are different, okay, according to different children. But remember, the age is same. Age is 10 years. Now, if the heights are different, then weight is also different according to the height. I cannot say all of the child should be 40 kg. Please mute yourself. Okay, so what I'm saying here is we check the height of all the children, and then weight for that particular height may be different for each of them, though their age is same. This concept is called weight for height. Let's explain this with the reference of your own class. In your own class, okay, the age of the most of the students is almost the same, maybe 1 or 2 year difference, but height differs. Some students are quite tall, some are average height, and some are a bit shorter as well. Now, if we say this is the normal weight for this particular age, I am wrong there, because a person who is tall should have more weight than the other person who is shorter. This concept is called weight for height. Very, very important these days. So wasting means deficit in weight for height. And stunting. Now, stunting means deficit in height for age. So it simply, consider height only for the age. Stunting means appearing shorter than another person of the same age. Stunting. And wasting is a feature of acute malnutrition. Stunting is feature of chronic malnutrition. So these are important concepts. Now see there, wasting means acute malnutrition, stunting means chronic malnutrition, and most of the time they often frequently coexist together. Now with this concept, let's talk about this current nomenclature by WHO. So this is the World Health Organization classification for undernutrition. So see here, moderately undernutrition and severe undernutrition. If symmetrical edema is present or not, it is usually not present in moderate but present in severe one. And this is important now. Weight for height is the measure of wasting. 70 to 79% of the expected is simply called wasting, and less than 70% of the expected is called severe wasting. If we consider the height for age, that is the measure of stunting, 85 to 89% of expected is called stunting, and less than 85% of expected is called severe stunting. Now, let me remind you once again, if you know how to calculate this percentage, this is nothing for you. It is very easy. That's why every student should know this concept, how to calculate this percentage. From where this percentage came, you must know this. And let me tell you again, this percentage comes from comparing with the standard one. We have a certain age with us. We have a certain height with us. What is the standard weight and height for that age we get from those standard chart? And that's why, and that's how we should say, calculate the percentage and then classify accordingly. Now with this, okay, there is a small exercise for you, all of you, okay? So please, let's spend a bit of time here. Do this exercise, okay? I will provide you the expected weight here. Now let's go through this. A 2-year-old male child had weight of just 6 kg and there is no edema. Classify his nutritional status according to IAP classification and Wellcome Trust classification. Okay, not WHO classification, because for WHO we need height and height is not provided here. So please do that. All of you, you know what is the expected weight of 2-year-old. Okay, let's take it 12 kg, make it easier. Let's say it is 12 kg, though it is around a bit less than 13. Let's say it is 12 because it's easy for us to calculate. Can you do that now, all of you, please?
Yes, sir.
Yes, sir.
Yes, 50.
Yes, expected weight is 12 kg for 2-year-old. Now you calculate the percentage first. The present weight of that child is 6 kg only. So what is the nutritional status according to IAP and Wellcome Trust? If it is difficult for you, okay, let me teach you right now and I can give you some homework later on. So please focus here first, okay? Because I'm thinking many of the students are confused here.
Saragi is
50%. 50%.
50%.
Okay.
And for Welcome Trust is marasmus.
Okay. Now see that.
Marasmus and in 4th grade.
Very good. So according to IAP, it's 4th grade, and according to Wellcome Trust, it is marasmus. So see that I'm already getting some of the answers. But for the sake of all other students, okay, who are focusing here now, so let me explain this. Please listen carefully. Now first, I need to calculate the percentage. And to calculate the percentage, the weight of this child is 6 kg. And I have given the expected weight 12 kg. Now you may be wondering from where I get that expected weight. That is from the percentile chart. You can see this later on when you have availability of the chart. Now 6 by 12 multiply by 100. Okay, multiply by 100. Now how much it would be? Okay,
50.
how much?
50.
Exactly, 50%. This is 50%. Now, according to IAP classification, if the weight for age is 50 or less than 50%, it is grade 4 malnutrition. And according to Wellcome Trust classification, less than 60% of, okay, expected with edema is marasmic kwashiorkor, but here there is no edema, so it is only marasmus. It is only marasmus. So that is the answer you need to give. According to IAP classification, it is grade 4 malnutrition. According to Wellcome Trust, this is marasmus. Now similarly, can you solve second one now? It will be easy now. Yes.
Sir, it's a Kwashiorkor
Okay.
and second grade 2.
Grade 2. Okay. So 3-year-old. Now, how did you found out what is the expected weight of 3-year-old? How much kg you kept there? That one you probably don't know, isn't it? It's not 12 now, right? It has to be around 14. So can you put 14 kg as the expected weight now and do it again? Yes.
Okay, sir.
So anyone? No share. So 8 divided by 14. So and multiply by 100. It's equivalent to 57.14%, isn't it? Yes.
Yes, sir.
Now it will be very easy for you. Where does that 57% falls in IAP classification? Where? Which grade?
Grade 3. Grade 3.
Grade
Exactly.
3.
3, sir.
Very good.
3, sir.
This is grade 3 malnutrition according to IAP classification. But according to Wellcome Trust, this child is having edema and the the weight is 57 of the expected. So where does it fall? What is the classification?
Sir, marasmic kwashiorkor.
Marasmic
Marasmic and
kwashiorkor.
Very
Yes.
good. Marasmic kwashiorkor. Excellent. So this is the way you calculate it. Okay. Now after this, I'm sure there won't be any problem. Let's move on. It's a very important question which will be asked to you in your future exams. Now these are the percentile chart. Okay, there is nothing to discuss here. It's every student know how to find the expected weight or expected height. So let me remind you once again. You check the age of that child first, which is provided by the mother or the father. Now let's say this is the 3-year-old child. Okay, 36 months is 3 years. Just trace it upward and look at the point where it touches 50th percentile line. So this is the expected weight for 3-year-old child. This is the way you do. Now let's see the length. See there, there is the age. Let's say 2-year-old now. See this. Let's go right here. Okay, see this. Now where is the 50th percentile here? This line. So the intersection between these two lines is the expected length of this particular baby. This is the way. This chart is for girls. Okay, there's a separate chart for boys and girls. Everything else is same. This is the head circumference and weight for length percentile. Weight for length, also known as weight for height. So it's for girls. Now with this, okay, let's move on. The third type of assessment for us is because of lab investigation or lab test. Now, what test we send to the lab and what is the interpretation? Now let's focus here. These are some of the useful tests which we send all the time in case of severely malnourished baby. Blood glucose is probably the first investigation which I like to send, because there is high chance of hypoglycemia in severely malnourished child, and hypoglycemia can cause damage to the brain. Less than 54 milligram per deciliter blood sugar level is known as hypoglycemia. Second, examination of blood smear by microscopy. This is mainly done for malarial parasite diagnosis. Okay, malarial parasite. All of you know the different types of malarial parasite, isn't it? Also known as plasmodium. There are 5 species of plasmodium. Plasmodium falciparum is the most severe one. Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. This Plasmodium knowlesi is a relatively newer one. And many of the older textbooks, it was not even mentioned. Okay, but these days, it is the 5th one. So falciparum, vivax, ovale, malariae, and knowlesi. All of these can be diagnosed with the help of malarial parasite smear examination. Another one is hemoglobin or PCV. Hemoglobin or PCV. What is the full form of PCV? What is
Excess
PCV?
volume.
Packed cell volume.
Good. Packed cell volume. Very good. Packed cell volume. Packed cell volume is also known as hematocrit. Only the RBC mass, okay, that is packed cell volume. So hemoglobin, if it is less than 40 gram per liter or 4 gram per deciliter, 40 gram per liter or less than 4 gram per deciliter, or PCB less than 12% is indicative of very severe anemia. If they ask very severe anemia definition in malnutrition, you can answer like this. Less than 4 gram per deciliter hemoglobin is very, very low. Urine, routine examination and culture and sensitivity. You need to be familiar with this short form, okay? RE means routine examination and culture and sensitivity. Now, if there is presence of bacteria on microscopy, and if there are more than 10 leukocytes per high power field, this is suggestive of urinary tract infection. HPF is high power field. That's how they count how many leukocytes are there in the urine. And presence of bacteria on microscopy and with culture and sensitivity, if there is growth, this is indicative of urinary tract infection, which is very common in severely malnourished child. Now, what are the other lab tests we like to do? See here, examination of feces by microscopy. This is called stool examination. Stool examination, if it shows blood in the stool, it is indicative of infection. I just now told you, if blood is there in the stool, this is suggestive of dysentery. Dysentery. And dysentery is mainly caused by some bacteria and one of the protozoa. So which protozoa I am talking about here? Which protozoa usually causes dysentery? Yes?
E. coli.
No, E. coli is not a protozoa. E. coli is a bacteria. Which protozoa? From microbiology and parasitology. So let me write that for you. It's a quick knowledge. Regarding the protozoa, if,
histolytica.
exactly, very good. Entamoeba histolytica. Okay. Entamoeba histolytica. This is the protozoa, okay, which leads to amoebic dysentery. This is called amoebic dysentery. Others are bacteria. Others are bacteria. Let me write it here. Okay, there's a bit of space here. So these bacteria are Shigella, very, very important cause of dysentery. Okay, Shigella. Some other bacteria also, produces blood in the stool. One of that we have already studied, enterohemorrhagic E. coli. Enterohemorrhagic E. coli. Okay, then O157, okay, H7. This is the name, enterohemorrhagic E. coli O157H7. Another bacteria which is causing similar type of problem is Campylobacter jejuni. So these are the quite familiar questions for you whenever this type of discussion comes. Now, a small question for you: what is the meaning of this O and H? Who can answer me? O and H, what is the meaning? Anybody? The microbiology knowledge is not good. Okay, you need to really push through that knowledge actually. Now see here, O means somatic antigen. O means somatic antigen of that particular bacteria. H is a flagellar antigen. E. coli has flagella. That's why it can move because of the flagella. So H is a flagellar antigen. O is a somatic antigen. So accordingly, we have classified into different serotype. So this is one of that serotype, EHEC O157H7, and this very commonly give rise to one particular disease. So who can tell me what is the name of that disease here? Anyone? Hemolytic uremic syndrome. HUS is caused by EHEC O157H7. HUS is also caused by Shigella. Now let's move on. Let me admit some of the student. Okay, now see here. Now another one is presence of Giardia cyst or trophozoite. Now Giardia lamblia can have two important form there, cyst and trophozoite, just like Entamoeba histolytica. So presence of the cyst or trophozoite in the stool will almost confirm giardiasis. And Giardia lamblia is also a type of protozoa, but it doesn't cause blood in the stool. It causes watery type of diarrhea, watery diarrhea. It can also lead to chronic type of diarrhea, okay, chronic. And that chronic diarrhea is associated with malabsorption in case of giardiasis. Chest X-ray is a very important lab test which is done for the diagnosis of pneumonia or congestive cardiac failure. Pneumonia, even pulmonary tuberculosis and heart failure, all of them can be diagnosed with the help of chest X-ray. So it is always done. MAN2 test, okay, it is pronounced as MAN2, MAN2 test. This X is a silent here. MAN2 test, okay. What is another term for MAN2 test? Yes? Another term. PPD test, okay, PPD. PPD means purified protein derivative. Purified protein derivative test. Or it is also known as tuberculin test. Tuberculin test. Okay, so these are some of the important terms. So here, PPD test, tuberculin test, or MAN2 test. These are synonym. It is given, okay, to find out whether that child is already infected with tubercle bacilli or not. So this is a sensitive test for the diagnosis of tuberculosis, but it is never specific. It is often negative in children with TB, in malnutrition. But remember, if the child is not malnourished, then it is often positive. But if the baby is malnourished, and even if the baby is having TB, this MAN2 test would come negative because of lack of immunity in case of severe malnutrition. Another small question here. Which type of hypersensitivity reaction is MAN2 test? Yes? Which type? Yes, yes, Irfan?
Yes, sir, it's type 4.
Exactly, type 4. It is type 4 hypersensitivity reaction, and to elicit type 4 hypersensitivity reaction, we should have a good immunity. If immunity is very poor, then MAN2 test would be negative, which exactly happens in case of severe malnutrition. Now, these are the tests which we can do, but they are of little value in case of severe malnutrition babies. They are serum protein, okay, HIV test, and electrolyte. Now, serum protein are not useful in the management. This is management, but they may guide the prognosis. If serum protein is very low, prognosis will be poor during the treatment. HIV test, it is never done routinely. We should always suspect it first. Okay, we should always take consent of the parent, and then if it is done, the results should be confidential. Nobody else should know the result that this person is HIV positive. Otherwise, there will be a big problem there. First of all, babies are getting HIV from the mother or from the parents. So parents should be checked. If they are positive, then only baby should be done HIV test, and results should be confidential. Serum electrolyte, they are rarely helpful, but they may lead to inappropriate therapy.